The net water uptake is a measure that you can extract from a stroke CT head scan. It's a non-contrast CT image, and it's a measure of how dark the stroke lesion is. The way we calculate it is we measure the ischemic core on the non-contrast CT using the e-aspects module. We then compare how dark that bit of the brain is compared to the same region on the contralateral hemisphere. The higher the net water uptake value, the darker the region of the brain injury, and the more severe the ischemic injury to that part of the brain. The net water uptake is effectively a measure of stroke severity. We're well used in stroke to measuring how large a stroke is, whether you use a score like the aspect score or a volume like you might use from the e-aspects outputs. But the net water uptake is a different dimension. It's a complementary measure which tells you how dark the lesion is and how severe the stroke injury that's already established is. We know that's important because it's a marker of blood-brain barrier dysfunction and vasogenic edema, and it suggests that if you have a higher net water uptake value, you're more likely to get reperfusion injury and less likely to benefit from treatments such as thrombolysis and thrombectomy. Net water uptake provides the clinician with an additional dimension in terms of information when making treatment decisions about patients or transfer decisions in the context of a stroke network. The more severe the stroke injury, the higher the net water uptake, the less likely the patient is to benefit from interventions. So particularly for those edge cases, it provides that additional context in order to inform treatment decisions about what might be best for an individual patient. I think the greatest benefit for net water uptake, as the evidence is emerging, is going to be for patients with large core ischemic strokes. Those patients with large vessel occlusions and extensive injury already established on their non-contrast CT. We know that the benefits for these patients can be more modest than patients with smaller cores, and selecting the patients who are likely to benefit from thrombectomy in that setting is difficult. Net water uptake is likely to be a strong predictor of futility or benefit from thrombectomy in these largest core ischemic stroke patients. Brainomix has a comprehensive portfolio of tools to support image interpretation in patients with acute stroke. But we really pride ourselves on the non-contrast CT functionality, and the net water uptake adds another dimension to that. We can already measure the extent of injury on non-contrast CT using e-aspects, an automated aspect score, as well as the acute ischemic volume on the non-contrast CT. Net water uptake adds another dimension to that. So again, just from a simple, routinely available non-contrast CT, we can get information not just about the extent of the injury and the amount of brain that's injured, but how severe the injury is, how dark the lesion is, how much vasogenic edema has already been established within the stroke lesion itself.